Welcome. I'm Bill Sachel, the Clinical Director for Vasomedical. I'm here to provide you today with an orientation to the Lumenair system and to EECP therapy. This orientation is not meant to preclude clinical training, but rather to be an overview of the therapy and of the system. The Lumenair requires quick connect hoses. Quick connect hoses should be left attached to the treatment table to prevent dust and dirt from entering the valve assembly. Cuff side couplings are used to attach the cuffs to the hoses. Vasomedical treatment pants and treatment cuffs. When sizing vasomedical treatment pants and cuffs, we size from the waist down, looking at the patient's leg girth and length. With the tights, we want these tights to be skin tight, and we want to size down with tights. When it comes to the cuffs, we may want to size up or have a little bit of a larger cuff, as the larger cuffs have larger bladders, which provide more compression and a better squeeze. Power switch at the foot of the bed is turned on, initiating the compressor and initiating the computer and the computer screen. The computer screen goes through its setup. The welcome screen provides 4 switches: patient information, site information, simulation mode, and the EECP treatment screen. In order to provide therapy, you'll need alcohol prep pads, New Prep, a mild abradant, and sometimes Signagel. You will need 3 electrodes, 3 sponge core electrodes. Snap the electrodes onto the ECG wire and drape over the system. Either using a step or some other mechanism in order to get the patient onto the treatment table safely. Center the patient on the treatment table, aligning the seam in the patient's pant with the seam in the patient's cuff. Grab by the inner 2 flaps, pull high up into the groin, steadying with your left hand at the hip. Have the patient drop, loosely wrap the abdominal strap, straddle the patient, lift, making sure that the hoses are equidistant on each side of the patient. Drop. Clear the treatment pants of all wrinkles and creases. Pull socks down to the ankle. Pull the treatment pants down below the heel. Have the patient pull from the waist up. Pull your pants from the waist up. This gets all of the wrinkles out of the tights. Set up the calf cuffs with the seam on the lateral part of the leg, 1 finger's breadth below the knee, capturing the gastrocnemius muscle in the pouch where the bladder is at. Pull with both hands, plant, and wrap with no wrinkles or creases. Wrap the thigh cuffs, pull high up into the groin with both hands, plant, wrap, bring the seams together, try to align the piping, no wrinkles, no creases. You can wrap and rewrap. Tighter is better. tighten the abdominal strap. For patients with a larger abdominal girth, an extension strap is available. Attach the extension strap to the Velcro, allowing for greater girth. Apply the ankle strap. Rigorous skin preparation is essential to ECG signal quality. To initiate treatment, we need to access the EECP treatment screen. We identify our patient. We use the up and down buttons to toggle up and down from one patient to the other, and then we go to begin treatment. To start treatment, we're going to touch the start button. The system starts at low pressure of 80 millimeters of mercury. Even at low pressure, we see some diastolic augmentation occurring on the screen. Pressure rises in increments from 80 to 200 millimeters of mercury in 40 millimeter increments. So 80 to 120. How you doing there? Good. 120 to 160. How you doing?
Pretty good.
See how my patient's smiling. 120 to 160. 160 to 200. Once we reach 200, pressure increments are now 20 millimeters of mercury. So from 200 to 220, 220 to 240. The standard treatment pressure for the Lumenair system is 240 millimeters of mercury plus or minus 20. The ECG is utilized to trigger inflation and deflation. The R wave is the trigger. We optimize inflation and deflation timing. We inflate at the closure of the aortic valve and we deflate just before the next systole. We base this timing on the finger plethysmograph waveform. The Vasomedical Lumenair EECP system allows for direct delivery of pressure from the system to the cuffs. 3 pressure tanks are placed right below the patient, delivering patient pressure directly to the cuffs. A small amount of residual pressure is left in the cuffs also at deflation to allow for a quicker inflation rise time. At the end of the hour of therapy, an alarm will sound. We'll press the alarm button, remove the finger probe, open our straps, and allow our patient to go home.